So now moving to chronic diabetic complications, where you have macrovascular complications. So one of the biggest complications you see in a diabetic individual, macrovascular meaning where your big blood vessels are affected, okay, like your arteries, all right, arteries, veins, things which you can, easily see your arteries over here, all right. So macrovascular complications include metabolic syndrome secondary to insulin resistance. Metabolic syndrome is a cluster of disease which has dyslipidemia, hypertension, atherosclerosis. Hypertension, one of the reasons for hypertension in a diabetic individual could be because of magnesium deficiency. Atherosclerosis could be because of inflammation as well, secondary to insulin resistance. Just remember, one of the most common macrovascular complication in a diabetic individual is metabolic syndrome, or else they may independently have dyslipidemia, hypertension, atherosclerosis as well. I'll be going through the macrovascular complications in further detail. What is microvascular complication? Microvascular complication is when you have glycosylation of your small blood vessels. So you have tiny capillaries, okay? So like similarly to the concept of heart, you know how when you have fat layers, plaque, okay, or fatty streaks, when you have plaque in your artery, it clogs your artery, right, in simple layman terms. And that is when you have your fat buildup in your artery, and therefore you have a heart attack, right? Similarly, glycosylation of blood vessels means you have glucose molecules which are accumulated in your small fine capillaries, all right? So in your microvascular capillaries, okay, which you need a microscope to see, therefore they are microvascular, you have accumulation of glucose molecule, and this is called as glycosylation of blood vessels. So when you have tiny capillaries, say in your fingertips, which gives you these sensations, therefore you can feel something when you are rubbing your fingers, all right? So there are microcapillaries over here, okay? Now, when these microcapillaries are glycosylated, when they are glycosylated, then what happens? Your sensation is numbed. When your sensation is numbed, even when you cut your finger, you may not feel the pain because you don't have that pain sensation, okay? All those microcapillaries, they are clogged. In layman term, they are clogged because of glucose. And remember, when you have microcapillaries which are glycosylated, all right, and when you have, you cannot sense it secondary to glycosylation. Now when you have a cut, and when that cut is exposed to the environment, bacteria love glucose, they will infest it. You will have sepsis. If sepsis is not taken care of, that will go into gangrene, and gangrene may require amputations. Make sense? You see how all of this is connected? Okay, so now we'll go through various microvascular complications, but remember the underlying cause being glycosylations of your small blood vessels. Okay, so the first microvascular complication which is seen in a diabetic individual is nephropathy. Okay, so what is nephropathy? Nephrons are the cells of your kidney. Okay, therefore, nephro, okay, nephro meaning cells of your kidney, nephrons. Nephropathy, okay, so nephropathy is when you have impairment of your kidney cells, okay. So when you have glycosylation of your kidney cells, nephrons, then what happens? The first symptom which you see is microalbuminuria, meaning you have small size protein loss in your urine. See, healthy individuals like you and me will not lose protein. Protein is such a valuable nutrient to the body. The only thing which has nitrogen, only nutrient which can help in the building of your muscles, in generating of your cells. Okay, carbohydrate and fat cannot do that. All right, they have other important functions. So your body does not like to lose protein. Okay, but yes, the first symptom which you see in nephropathy is microalbuminuria. You're losing small cells, small protein cells. Then you have macroalbuminuria, meaning large protein cells are lost. Why is this happening? Because you have glycosylation of your glomerulus filtrate. If you do not remember physiology, that's why physiology is also so very much important for this unit, guys. Okay, so when you look at physiology, You look at the cell structure of your nephrons, which are the cells of your kidney. You have your glomerulus, okay, which is like that pouch sort of a thing. That is where all that filtration happens. Glomerulus is like a sieve, it's like a filter. It filters all the protein. It does not let protein pass in the urine. That protein is taken back in the blood. It takes all the other toxic compounds like urea, ammonia, anything else, and it throws it out of the kid. It throws it out in the urine. Okay, so that is why glomerulus is so important. Now, glomerulus is made up of fine microcapillary. Okay, but now you know you have glycosylation of this microcapillary, meaning you have glycosylation of your glomerulus. All right. Therefore, you have a decreased GFR rate, glomerulus filtrate rate, meaning you have decreased urinary output. When you have decreased urinary output, you then go to chronic kidney disease. You have various stages of chronic kidney disease depending upon the urinary output, which is one of the indicator, not the only indicator. So depending upon the urinary filtrate rate, your chronic kidney disease output, your chronic kidney disease stage can be classified. All right. When you have no urinary output, okay, you have ayuria, meaning zero urinary output. Your kidney glomerulus glycosylation is so bad that your kidney cells are dead. They cannot produce any more urine. That is when you have kidney failure. That is when you go on dialysis. Okay, dialysis is like you have an external machine which acts like the kidney for you. Basically, what's the function of kidney? To purify your blood, to take all the crap from your blood and to throw it in the urine. When your kidney cannot do that, the machine will do it for you. Of course, it impairs your quality of life. That's not natural. And it's very painful as well because you have catheters inserted in. Okay, so basically just a general overview. In these individuals who have diabetic nephropathy, they may be advised a low protein diet because they do not have sufficient kidney capacity to process and eliminate the ammonia, convert it into urea and throw it out as urine. Okay, and you know protein is all about ammonia. All right, so the nitrogen group converted into ammonia and then urea. When you don't have that capacity, you cannot when your kidney capacity is lost, that is when you go on a low protein diet. These individuals will also have a low potassium diet. Why? Because the kidney functioning is impaired. You're not throwing out the electrolytes. Remember the basic thing which you learned in food science: excessive amount of electrolytes can be thrown out in the urine from the body. Okay, so the excessive amount of electrolytes are like your sodium, potassium, magnesium. All of these are thrown out in the from the urine. Okay, but unfortunately your kidney filtration function is lost in nephropathy. So then what happens? You have less excretion of potassium. You have high potassium in your blood. Very high potassium in the blood is very scary because it leads to hyperkalemia. Okay, so hyperkalemia meaning high potassium in the blood, which can lead to myocardial infarction, MI. Okay, so heart attack basically. Okay, because when you have high potassium, it impairs your functioning of your heart muscles, and this can lead to heart attack. Okay, so you don't want that. So individuals with nephropathy, they are on a low protein diet, they are on a low potassium diet, they are even on a low phosphorus diet. Okay, there are many other factors to consider in nephropathy when you are say planning medical diets for these individuals. So yes, low phosphorus in diet. Again, why? Because as I said, your body cannot throw out the excess amount of phosphorus via urine. So what is this excess phosphorus in the blood? If you have excess phosphorus in the blood, what will happen? It will leach out calcium from the bones. Okay, therefore it will lead to osteoporosis, and all that extra calcium which is floating in your blood, it will start settling down into your blood vessels, into your soft tissue, and therefore it will cause calcification of soft tissue. This is again what I spoke about when I was talking about magnesium and diabetes in the earlier slides. Okay, and that is why it is not favorable. So that's why you have a low phosphorus diet as well. Of course, one of the main medical management which you do in this is they are on diuretics. All right, that is if the kidney is functioning. If the kidney is not functioning, you can't do anything, then it is just dialysis, meaning ayuria, when you have ayuria. Okay, but yes, they have a very delicate medical management. I'll go on to retinopathy. So now retinopathy, as the name suggests, retino meaning eyes, okay, retinopathy. So when you have glycosylation of the microcapillaries in your eyes happening, that is when you have retinopathy, okay. So the first stage of glycosylation of microcapillaries in your eyes is called as glycoma, okay. Glycosylation of the existing blood vessels in your eyes, that is called as glycoma, okay. When you have these glucose settle down in the blood vessels of your eyes, these blood vessels, they start swelling, okay, because they want to increase their surface area. Because there is so much of glucose settling down in them, they do not have sufficient space for the blood to flow in the flow, all right, or from one side to the other end, okay. So that's why these blood vessels, they start swelling. This is called as aneurysm, okay, meaning you have swelling of blood vessels, all right. First stage is glycoma, glycosylation of your blood vessels. This results in aneurysm, which is swelling of your blood vessels. Then what happens? The blood vessels can only swell up to so much point. Then you may have breakage of these blood vessels. This is called as hemorrhage. Okay, so blood vessel hemorrhage. So when your blood vessels inside your eyes, they break, okay, then these individuals, generally they complain of seeing black spots when they are looking at things. So when they are looking at things, they may see black spots in their vision. These black spots are basically blood patches because their blood vessels are breaking, okay. And therefore what the reflection, what they see in their retina is those blood vessels which are breaking. So they are blood spots, okay. Then what happens? The blood vessels which may say, for example, break, they may die at the end. Or even if they are not broken, because of so much of glycosylation of the blood vessels, there is no nutrient and oxygen flowing to the other end, because there is so much of glucose deposit in the between. Therefore these blood vessels may start dying. So the blood vessels may start dying because of glycosylation in itself. The blood vessels may start dying because of hemorrhage as well. And this leads to necrosis, meaning death of the blood vessels, death of the cells, okay. And because these existing blood vessels are dying, then you have new blood vessels or microcapillaries which are forming in your eyes. This leads to a big wire mesh, okay. And these microcapillaries, they are just say they are just developing anywhere and everywhere, okay, to bring some blood supply into your eyes. This creates a big wire mesh, okay. And this wire mesh becomes so dense finally that it covers your vision, and therefore this can result in blindness. So diabetes can result in blindness because of glycosylation of the blood vessels, okay. All right, then you have neuropathy, which is when you have glycosylation of your nerve endings, of your neurons. So neurons are the cells of your brain, okay. So when you have glycosylation of your cells of your brain happening, the nervous system will get affected. Always remember, nephrons and neurons cannot be regenerated in humans, okay. Right now our stem cell technology is not that advanced that we can regenerate naturally, organically, the stem cells of our brain and of our kidney. So once they are dead, they are gone forever, okay. So yes, in neuropathy, you have glycosylation of your neurons happening. When your neurons are glycosylated, your nervous system gets affected, meaning your autonomous nervous system will get affected, meaning your sympathetic and your parasympathetic nervous system will get affected, okay. Therefore, you will start losing sensations in your hand and feet. You will have pin pricking sensations as well, okay, at times. But basically, no sensation, meaning high risk of cut, wounds, which could be ulcerated, and this can turn into sepsis, gangrene, amputation, okay. So yes, and guys, because you have because you have glycosylation of the nerve impulses, even your heartbeat may be affected, and this can result in silent myocardial infarction, MI, okay, because your cardiac nerve impulses is impaired, all right. So yes, you may not feel the pain in the heart attack, and these individuals may die of silent myocardial infarction, which is because of secondary condition, that is glycosylation of their neurons, all right. And guys, glycosylation of your GI system, okay, the neurons which is surrounding your gut, as I said, the there is a neuronal system which is surrounding your GI tract that gets glycosylated. That is when you have conditions such as gastroparesis. All right. So now when you have glycosylation of the nerve endings of your reproductive organs, that is when you have all these sexual dysfunctioning happening, such as impotence. All right. Oh, so yes, I covered it over here. So yes, gastroparesis happens because you have glycosylations of the nerve endings of surrounding your GI tract. Therefore, you have that delayed GI emptying, which I explained over there. And thus the symptoms are nausea, vomiting, bloating, constipation, diarrhea, things like that, because the food is not being taken from the stomach into the intestine naturally. The peristaltic movement is lost. Okay, the food is just dumped in the stomach and it's just sitting over there. Therefore, you feel nauseated, vomiting, constipation, diarrhea, bloating, and all of that. Okay. And then the medical management is medical nutritional therapy. I talked about this in brief. Small frequent meal, low fiber diet, low fat diet. All right. So all of that applies over here. Then you have medications like anti-nausea medication you may take, but these medications are more to address the symptoms rather than the root condition, the underlying condition. Okay, one of the things which is done is also enteral nutrition. You even have surgical, say, management. So one of the surgical management is where you have electrodes which are inserted in your stomach. So they give a small little electric shock. So the stomach will start its peristaltic movement. But as I said, that electric shock is generally given naturally by your nerve impulses. So basically, as you know, what does your neuron do? It transmits neurotransmitters. What are neurotransmitters? These are chemical impulses. These are like small little electric waves which are going throughout your body, right? That's why you can move your hands, legs, and your body is functioning. So the small little electric waves that are naturally generated in us because of neurotransmitters, secondary to our nervous system, glycosylation will impair the neurotransmittory system, the nervous system. Therefore, now you have external electrodes which will give you that small shock to stimulate the peristaltic movement of your stomach.
Hello, everyone. So in the previous slides, which speak about complication of diabetes, we saw nephropathy, and in nephropathy, I spoke about how the dietary management would involve um, probably a low protein diet and even management of electrolytes such as potassium. I wanted to highlight that there is recent new evidence about potassium, which is why do we say that you may need a low potassium diet and not you will always need a low potassium diet? Because the latest evidence suggests that you need to eliminate all other medical causes of high potassium blood levels before jumping to diet and reducing the potassium level in the food, all right, or in the diet that the patient is having. So these are the links for the discussion around low potassium diet not being the first strategy. If you see high potassium levels in the blood, first eliminate all the other medical causes and then consider and see whether the patient needs a low potassium diet. So the conclusion is that not every patient needs a low potassium diet. It is very case by case basis. And this is a very good Nemo resource that I found, which summarizes in simple words um, various medical causes of high potassium. So, for instance, high potassium, the kind of causes that one needs to eliminate, the treatment management team needs to eliminate is that is the patient suffering from constipation because that can lead to high potassium levels as well? Is the patient having high blood sugar levels which are not managed properly? All right. Then some medications, for example, can cause high potassium levels. Missing dialysis, very, very important. Then high acidity levels in the blood, muscle breakdown, muscle wasting, and exercising before a blood test, because these are all of the various sort of causes which can cause high blood potassium levels. So when you see high potassium levels in the blood, do not jump to conclusions that, okay, let me put the patient on low potassium diet. No, first you have to discuss with the treatment management team Are there any other medical causes that needs to be addressed before jumping to, say, a diet which is restricted in potassium? All right. So yes, patient may need a low potassium diet, but it is very individual case to case basis. But do not jump directly to a low potassium diet before having this sort of a critical thinking around it. Okay, so just wanted to highlight that there is evidence around this, and this evidence is predominantly with chronic kidney disease. This is a topic which you cover in medical nutritional therapy too. So it's not that this content is examinable in your MNT1, but when we speak about diabetes, a lot of diabetes patients, as you appreciate, do end up having kidney disorders. Therefore, these two topics are very linked and integrated. It would be unfair for me not to highlight this point to you at this stage, even as a FYI, so that you have this at the back of your mind when you actually formally study more about kidney disorders in your MNT2. Okay, so this is just to let you know that this is the latest evidence around it. So yes, hope this extra information at this stage helps. No, you will not be assessed on, you won't have a question in exam in MNT1 saying that, okay, what are the medical causes of high blood potassium? List that or something. Okay, so I won't be going into that direction for you. So this is to rest assure you that this is not as part of exam in MNT1, but you need to understand this because this is very linked. Diabetes, kidney disease, very strongly linked to each other. And it's important to just flag it at this moment. Okay, so I'll stop the recording now. Thank you.